The statements and opinions expressed in this episode are those of Dr. Sigman and his guests, and do not necessarily reflect the views of Relied.
It's time to do healthcare smarter. This is Smart Medicine, hosted by Dr. Scott Sigman and powered by Relied. Your voice matters. Yes, you, the person listening to this episode right now. As physicians, our reputation is one of the most valuable things we've got. And if you're in private practice, that reputation isn't just personal, it's your business model. And in today's digital world, that reputation doesn't just stop at the exam room. We're literally seeing it every day. A strong online presence is helping all kinds of doctors build real connections with patients before they actually ever meet. If putting yourself out there online feels intimidating, you're going to love today's guest because he is one of the very first physicians to ever consider doing exactly this. Joining me on the mic is fellow doc, podcaster, and the godfather of online physician branding, Dr. Kevin Foe. His platform, KevinMD, has become one of the most respected spaces for doctors, patients, and healthcare leaders to share real stories and real insights. So if you're ready to find your voice and establish your brand, keep this episode rolling. Kevin, you've inspired so many of us to step up, speak out, lead with authenticity. It's an honor to have you here on Smart Medicine. Welcome to the show.
Scott, thank you so much for having me.
It's a pleasure. So listen, as a true believer in physician branding, it's such a treat to have you on the podcast. You know, you could be called the physician branding guy, the OG, the godfather of physician branding, whatever you want to say. I went to ChatGPT and I said, let's see what ChatGPT has to say. And they said, you are a trusted translator of healthcare stories, an advocate for authenticity, a reputation builder, someone that is an amplifier of voices. What would you add or change?
Well, I don't know where ChatGPT got that from, but let me say that checks in the mail to whoever it got scraped up from, right?
Well, somebody in there doing their job. I don't know. I haven't met the guy yet, but it helps me every day. That's for sure.
So that encapsulates my goals. I do want to share stories, not just from physicians, but people across the healthcare spectrum. One thing I certainly want to add to that is that I myself am a practicing physician. I'm down the street from you. I'm in Nashua, New Hampshire. I do internal medicine, primary care. I've been practicing for 23 years now. And when we talk about authenticity, I think that is a critical piece of it. I'm not just a physician in name only. I'm not just one of those physicians who only write and not see patients, or a physician politician who no longer see patients. I still see patients Monday through Wednesday, primary care. So I know what's going on, not only from the physician point of view. I know all the obstacles that physicians face, but of course I see it from patients as well, and how much they're struggling along their healthcare journey and how many obstacles our healthcare system places in front of them. So I think that lends an additional layer of authenticity to what I do on my site and the stories that I share.
Yeah, that's awesome. Both from the physician's perspective, but also from the patient's perspective. I really, really enjoy that. So look, I mean, you're practicing for 23 years. And at one point, though, you realized that there were some stories to tell outside of the exam room. It wasn't just about medicine. And you were truly way ahead of the time when it came to sort of physician messaging and branding. I mean, when you first started, I mean, marketing for physicians was really strictly taboo. It just wasn't done. I mean, we're contemporaries. I'm in this for a little bit longer than you, but at what point did you sort of shift from saying that it was just about medicine, but I think you probably started with a blog and really was really about storytelling in healthcare. What was the passion? What was the rationale behind it?
Well, it definitely was not part of a business plan. I did not have a 10-year plan, 20-year plan. I think that I adapted organically to what was happening outside of medicine. When it comes to social media and online platforms, I like to say that medicine's always a few years behind other fields. So you take a look at what's happening in other fields like technology and whatnot, and see how they're using online platforms, and you see the trends there. a few years later, it's going to apply to medicine. So you're right. I started my blog back in the early 2000s, and it was just really a place where I can just share my interpretations, share my thoughts on things that were recently published, because patients would read stories in the newspaper, right? And then they would ask me in the exam room, what does this mean for me? So I thought that it would be nice to share these thoughts on a blog where I can also educate not just patients one-to-one in the exam room, but one-to-many, of course, on a blog. And it's, like you said, evolved since then. So it's not only my voice, but now it's a platform where, as I said earlier, people across from the healthcare spectrum can really share their stories, because there are so many stories outside of the exam room that are relevant to physicians. There are a lot of things that lead physicians to burnout. And I always say that a burnt out physician is no good to patients. How can we give the best care that we possibly could to patients if physicians themselves are burnt out? And I think that it's important to get patients on our side by sharing some of the obstacles that we face, whether it's burnout or metrics-based medicine and the focus on money or electronic medical records. I can go on and on about all the obstacles that physicians face. And I think it's important that patients and those outside of medicine and our leaders hear about that from the ground, because if we could remove these obstacles that physicians face, we can just give better care to patients.
Yeah, it's about also taking back control of the things that we do. As physicians, we really sort of ceded control to large hospital systems and commercial payers and all the things that go on. And so it was sort of a great way to be able to scale a message, right? You're in seeing your patients, it's one patient at a time, but now you can communicate across a much broader platform. So I think that, kudos to you, really, really a great story. Now, you started with the written word, with a blog, but, it's a digital world now. And so you've moved on to podcasting, and you're a prolific podcaster, literally daily. And trust me, I know what it takes to produce a podcast. So it's impressive you're doing it every day. But what drew you to the new platform of having an audio video platform now, where you're really messaging in a very different way compared to earlier on?
Well, it's something that I've always wanted to do. I started the blog back in the early 2000s, and it was about 15 to 20 years before I said, I think that I want to hear these stories from my guests in their own words. I just never had the time to do that, right? Because managing a site takes up a lot of my time. But of course, then came the pandemic, where I was partially furloughed. My hours were cut, and I was sitting at home with a lot of time. I said, this is the perfect opportunity to start a podcast. So I learned everything I could about podcasting. I emulated some of the podcasts that I follow. I like the New York Times podcast, The Daily, and I just wanted a daily podcast. And really, it's blossomed since then. I'm close to 2,000 episodes. I've been doing this for almost 4 years now. And really, it's a treat for me, because I get to talk to my guests and really have 20 minutes of their undivided attention, and I can ask them anything I want. For me, it's a wonderful learning experience, but for them, it's a platform where they can share their stories from their own corner of our healthcare world.
We're kindred spirits, brother. I mean, I started the Ortho Show podcast in the midst of the pandemic as well. The world didn't need a sports medicine orthopedic surgeon for 2 months. And so I went up, we called it the master bedroom closet studio. It was the only place in the house that was quiet enough. We did 250 episodes, and I completely agree. It's such a passion to be able to share the stories of others in a way in which they can communicate for themselves. So right there with you, brother. So, it's funny. Again, we were talking about a digital world, and we talked about how self-promotion for doctors was never encouraged, incredibly frowned upon. But that's really changed now. People are comfortable looking at, what's the first thing you do if you're going to go buy a new car? You get on there and you do reviews, right? You're going to go see a doctor. My 85-year-old mother, Judy, Googles every doctor before she goes to see him. So, what's happening in healthcare today that's making branding so much more important for individual physicians? And why is it acceptable, and in my eyes, actually necessary for doctors to develop a brand in this digital era so you can message to your patients so they can identify who you are and what's so important to you in particular?
Yeah, I think it's absolutely critical to have some type of online presence, because, like you said, patients are Googling their doctors online before they even meet them. And if they don't have some type of online presence, what are you going to find? Some type of patient review site, right? So one of the things I always recommend to doctors is that they need to control the narrative that surrounds their name, get on LinkedIn, Doximity, social media sites, and really build that narrative around their name. Because if they can't control the story around their name, someone else is going to do it for them, and they may not like what they read online. So right now, I do think that you say branding, I just say online presence. It's so critical for physicians to have that online presence.
Kevin is absolutely right. Patients are literally Googling their doctors long before they show up in the exam room. But just how many are we talking about? A 2022 report found that 77% of patients search online for doctors either often or sometimes. And what's even more interesting, 62% of Gen Z and 54% of baby boomers said they wouldn't even consider a provider who has very few or zero online reviews. So yes, people are absolutely looking you up. And honestly, I get it. If you've had a bad experience with a doctor, that is not something you want to repeat. This is your chance to show patients who you are before they come to see you in the office. Let them know that when that door opens, you will answer, you will listen.
Right now, I do think that you say branding, I just say online presence. It's so critical for physicians to have that online presence.
That's really well put, but it still amazes me that some physicians still cringe about the idea of having an online presence. They're just happy to have the website of their group, if they will, which really doesn't talk about anything particular for an individual. But, you know, in this day and age, I think that an online presence is really about trust, visibility, you know, connection as well. And I think those are the things that really matter. So what do you say to doctors that say, you know, I can just stay off the grid. I'm going to build a practice the old school way. I'm going to shake some hands, kiss some babies, and talk to other doctors in the community. And it's going to be word of mouth. I'm just going to sit back and let my practice grow.
And you know what? That is perfectly fine. I'm not forcing any doctor to go online. I just have to share my opinions, and I typically give 3 reasons why I think it's important for physicians to be online. We talk about that online reputation piece, but there are 2 additional reasons I think are important as well. The other first reason is online misinformation, right? A lot of patients aren't just Googling their doctors online. They're, of course, going to Google, and now with AI, they're going to various AI sites to research their disease, and there's a lot of misinformation out there. And in this day and age, healthcare, of course, has been politicized as well, and that adds to the misinformation that is potentially out there as well. So I think it's important for physicians to share, create reputable health information for our patients to read. And then the other reason that physicians need to be online, and we talked about this earlier, is that loss of autonomy. So I think that it's important for us to advocate for our profession. We could talk about some of the issues that makes it difficult for us to practice medicine, and we have to do it in physician-controlled spaces. I always like to say that KevinMD is a safe space for physician opinions because I'm the one who edits it. I'm the one who chooses the articles that go on my site, and I'm a practicing physician. And it's important to have that platform where not only can we share our stories, but we could advocate for the issues that are important for physicians. And so our leaders, our political leaders and healthcare leaders can read it and hopefully act on it.
All right, so let's take a little deeper dive on the misinformation thing, because I think that's really important. You know, I'm the first to admit, like if there's a patient who comes in, you know, with a new medication, you know, or even like a CPT code or stuff, I'll grab my phone and I go right to ChatGPT now. I don't go to a book and look it up anymore. It's actually highly convenient, but it can also be confusing. So, you know, it's clear that visibility and connection matter to patients, to doctors. And that online presence is so important, especially with this flood of potential misinformation. And so talk about how you feel that the online presence and messaging can really close the trust gap in this era of misinformation, and how doctors, you know, online presence can rebuild trust with patients and also with the public at large.
So I think we need to get back to why we became a doctor, right? And that's the doctor-patient relationship. Right? Patients can go online. These AI tools, Gemini, GPT, they're getting increasingly good. But why do they go to the doctor? I think, do they just want a diagnosis and treatment? I like to think that we do more than that in the exam room. It's like having a calculator. Does that make math teachers? Do we no longer need math teachers because we have calculators now? No, we still need teachers. So I think that we as physicians in the exam room, we're more than just diagnosticians or ordering tests and ordering medications. I think that we need to be guides for our patients. We need to develop that relationship with patients because it's more of a journey whenever a patient gets that condition, and it's important for us to stay by their side. So we talk about that branding, that online presence. I think that deepens and builds that relationships because I think that's what patients still crave despite all the tools that we have, all these AI tools that can give increasingly accurate information. I think we as physicians are more than that to patients.
Yeah, and I think, you think about it two ways. I mean, with artificial intelligence and all the technology that's coming down, there are a lot of people that are, scared and worried about this technology that's coming through. I personally am very bullish for humanity. I think this is going to really help us to go to new levels. But I think that the physician-patient relationship will maintain throughout. We're going to have wearables, we'll have otherables, ways in which a doctor can monitor the progress of their patient without necessarily being in the exam room, but having the skill set to still be in that room and be able to talk to a patient and put them at ease and be able to help in a human way to describe their condition and what we can do to help them get better, I think is really a great point. So, I mean, you've talked about, again, you've made a very powerful point about whether it's physician branding or online trust, that, the sort of from the patient's perspective at this point, and that let's go to the patient side of the story when it comes to this. I like to say, I've been over decades building a messaging and a brand and an online presence for my patients so that they can identify who I am. And there's nothing more gratifying as a surgeon, as a specialist, walking up to my next new patient, as I entering the room, knowing that patient has chosen to be there to see me. They've done their homework. They've got a rotator cuff tear. They know how I treat my patients. They're not there because their primary care doctor told them they had to go or their insurance company told them they had to go. So that to me is such a rewarding aspect of developing my online reputation as well. So talk to me about, at its core, how does this help patients to understand how they should be reaching out to their doctors, the messaging, and the conversations they should be having with their doctors?
I'm always an advocate for patients being more informed, whenever they come research Google or research GPT. I think it's important that patients do their own research. In terms of that online presence, I'm always going to, I think that, like I said earlier, adds to that authenticity in terms of who they're seeing in the exam room. If they know you or they research you or they read your blog, listen to your podcast, it's almost like coming into a room and talking to an old friend, right? So sometimes I go into the exam room and patients already found out all about me. They listen to my podcast, they see my videos, and just having that familiarity, they're just one step ahead, rather than meeting each other for the first time and getting to know each other. They feel that they already know me. So I think that that's another added benefit of having that online presence, especially with audio and video now. They can almost know who I am before they see me.
Yeah, I couldn't agree more with you. They have a sense of being a part of something larger than they are. And that the fact that, they know who you are because they've seen you, they've been listening to you. And I think that really builds trust. And I think that's what really can help in that relationship between doctor and patient. And so again, we've talked about this bond between doctor and patient, but it's not just the patients that can benefit, right? I mean, you've had, 2,000 people on your podcast. You've had doctors come on board to provide their perspective of what they're seeing on a day-to-day basis. So, for the doctors, for example, that are in private practice, right? They're trying to compete with big hospital systems, and, how an online presence and branding can really be a true differentiator in a very crowded marketplace. And not just outside competitors, but even, within your own practice. Like I said, group practices, they have group websites. They're not focusing on the individual. And so for doctors in particular, how do you describe to them how an online presence can really help separate yourself from the sea of sameness of what's out there in the world?
Yeah. So I think that it really, it allows them to individualize. And like you said, a lot of these large practices, it's kind of corporate in terms of that online presence. But sometimes with a smaller practice, you could be more nimble. You could be more individualized. You could do more videos behind the scenes. It just makes you more human to patients. And I think that authenticity is what separates a lot of individual and private practice physicians from larger hospital-owned or academic practices. Another thing that I want to also bring up is that we're also siloed as physicians, right? We have that doctor's lounge that used to be in effect decades ago, and now no one goes to that doctor's lounge. But I do think also being online, and that means going to some of these physician groups on social media, and allows sometimes doctors who are practicing by themselves to commiserate and talk to and share stories with other physicians as well. Because I know that private practice physicians, they're decreasing in number. They're becoming more rare these days and age. So I think it's important for them to maintain that connection to their colleagues. And again, having that online presence or being involved in social media sites allows them that connection as well. So to sum up, I think that having that online presence allows them to add that extra layer of authenticity that these corporate websites sometimes gloss over, but also having an online presence or being online in social media allows them to connect with other physicians in this day and age where they're so siloed.
All right, Kevin, let's do a little practical exercise here, okay? We're going to do a little online presence / branding playbook for doctors and leaders that really have not had a presence. So I'm a private practice doc. I've been skeptical of this whole online thing forever. But you know something? I got to do it. So where do I start?
So you need to ask yourself why you want to be online. I think that a lot of physicians make the mistake. They have to go online because someone told them to, or if everyone else is doing it. So have some type of clear purpose. Why do you want to do it? And we talk about those 3 reasons. Do you want to go online to control the narrative around your name and build an online reputation? So when patients Google you, you can control that information. Do you want to go online to correct misinformation that's out there? Or do you want to go online to advocate for a profession or advocate for a specific cause? So you need to have a clear goal in mind. After having that clear goal, then you want to do something that you're comfortable with. Are you comfortable writing? Are you comfortable being on a video? Are you comfortable talking? Then there are so many platforms that fit your strength, right? So if you're comfortable talking and speaking, you could do videos, you could do a podcast. If you're comfortable writing, of course, then you could start a website, you could write on certain platforms. So you want to choose a platform that fits your strengths personally. And then the last thing I would recommend is that you want to dip your toe into water and again, do what you're comfortable with. And it could just be something like a LinkedIn profile or profile in Doximity where you just fill in your resume, and those things get ranked pretty high in Google searches. And then once you're comfortable with that, then you can maybe expand your digital footprint, but go in your comfort level. But I think that the biggest piece of advice is that you want to go online for a specific reason and don't just do it because someone told you to.
I love it. So choose your why, right? I think that's really a way to sort of sum up what you're saying. Choose your why. What's important for you? Identify your strengths, the things that you're good at, then develop your messaging, right? And then find the platform to be able to share that across so that things are good as well. Okay, we've talked about some great advice here on how you get started. We just went through that. And it's interesting, you also emphasize storytelling as a way to be able to share your messaging so that people can identify who you are. And authenticity is very important to you. You made that, very clear. And so the issue then sort of like, how do you identify and highlight your strengths, your passion, so that you can truly connect with your patients? Give us a couple broad strokes of advice in that area.
You mentioned stories. So I think that one of the ways that we can get our message to resonate is to couch it in stories, right? A story is worth 100 words, 1,000 words, right? Because that's what people remember. People don't remember factual information. They remember a story behind it. And that's one of the things when I was speaking, I talked about the speakers, whenever you want to influence or convince someone, or if you want to advocate for a cause, you want to make that information relatable, and then you have to do it in stories. So I think that storytelling, whether it's on a podcast or telling your story on a video or writing it down, I think that is tremendously powerful. And on my own site on KevinMD, I have so many stories because we could talk about burnout and the statistics, but if you don't frame those statistics in a personal story that a lot of physicians share, I think that becomes much less persuasive. So I think that is the number one tip that I can share. So going online, if you want to create content, you want to do it within that context of a story.
I love it. Knowing your why. When doctors move with authenticity and purpose, patients feel it. No matter what platform you choose, when your mission is clear, people understand why you do what you do. Without your why, you risk falling into that giant sea of sameness. Just another name on a directory. And let's face it, our patients clearly deserve better than that. All right, so you've got your why. But how do you make it real? How do you make it stick? You tell a story. Your story. And if your medical training hasn't turned you into a world-class storyteller, fear not. That's exactly where we go next. This episode of Smart Medicine is powered by Veradigm. Veradigm helps you work smarter by connecting the dots between data, technology, and real-world clinical workflows. They are making it easier for clinicians to focus on what matters most: great care. Patients come to doctors because of very personal issues, and being able to try and figure out a pathway for them to heal in a way in which they can understand it, I think is fantastic. So messaging is so important, and there's a lot of ways in which you can message these days. And so doctors are busy. And so the question is, this is the big question that I get a lot, do I do my own messaging, my own storytelling, or do I hire somebody to help me do that? I mean, for me, it's very obvious to me when someone else is writing a story for a doctor versus when they're doing it personally. What's your opinion?
Yeah, I completely agree with you. You have to do it yourself because we talk about authenticity. And if you don't do it yourself, if you hire a firm, or now if you use AI to do it, people can see right through that. In terms of creating content, it could be very easy. I think you want to incorporate in your workflow. For me, of course, I incorporate in my workflow every week. I do podcasts, and it's just the same thing every week. Sometimes for physicians, the one example that I like to use is that if they're in the exam room and they're counseling a patient on a specific condition, right afterwards, maybe they can record themselves a 30-second video about the condition they just counseled on. They could maybe do a little write-up. Now they could just dictate something, and then they could, put it in some type of transcription service. They could write it down, because now that we have these transcription services to transcribe it, and then now you have various grammar checkers, that could be easily a piece of content. So try to incorporate content creation into your workflow every day. And I know several physicians where that's very successful. They will just literally spend 30 seconds after coming out of the exam room and say, hey, I just talked to a patient about the importance of getting a flu vaccine. And then they literally would just recount what they counseled that patient on. And that could be a 30-second TikTok video, right? So I think that there are physicians who, when they incorporate in their workflow, that's a great way of doing it. Certainly is not for everyone. Like I said earlier, do it only because you want to, and not because someone is telling you to do it.
Yeah, no, I think that's really great advice. So let's flip the script just for a moment and just say, all right, what should we not be doing, right? So you're new to this, you're trying to develop messaging. What are the mistakes that you see that doctors are making for online reputation?
Yeah. The first, of course, is violating patient privacy. And it sounds like we've been talking about HIPAA for decades now, right? But some healthcare professionals still don't get it. I think there was a scandal somewhere in California in recent months where a group of healthcare professionals just kind of posted incriminating patient pictures all over TikTok. It went viral. And no matter how much we say not to violate patient privacy, we still see stories about that being done. I do think that the new generation of healthcare professionals, they've kind of grown in this sharing mindset, and healthcare is still a little bit of a different mentality from what they've grown up on. So I think that patient privacy has to be paramount, and we have to be careful about not violating that, whether it's on a video or whether that's something we write. So that's not the first thing that really overrides all my other other tips. And of course, you don't want to extend beyond your comfort level. Like I said, if you want to learn and, become a podcaster, like before I started podcasting, I didn't know anything about it. I just learned everything I could about it, and then you gradually get better. But I do think that you have to start somewhere, right? So don't wait until things are perfect before you jump in, right? So I think that if you wait till things are perfect before you jump in, then it's probably way too late. Dip your toes in the water. Don't be afraid to make mistakes when you're online. I know that perfectionist mentality is difficult to break in medicine, because what we do, if we make a mistake, patients get harmed. But when it comes to being online, it's okay if your first blog post or podcast isn't perfect. I still look back at my first podcast and I certainly cringe when I see that. So I think that you will get better. I think that if you're 50% prepared, just go ahead and do it, and then you'll slowly iterate and slowly get better. So jump in. Try not to repeat mistakes, and just learn. And it doesn't have to be perfect when starting to create content online.
Yeah, great advice. I agree. And really staying away from negative commentary as well, too, right? This is a community. It's a positive community. If you're not pleased with what somebody's saying, you're probably better not to say anything at all. But, keep it upbeat, try to be positive, stay away from negative energy. And I think that's really sound advice. So we'll move into our final segment. We're getting there. And that really, for patients in particular, into how they can sort of figure out and work through this online reputations that are available for doctors. So when a patient's looking for a doctor, they have a new problem or a new issue, maybe not necessarily a primary care doctor, but because they're going to hopefully stay with you for a long time because you build that relationship. But how does a physician's online presence really help a patient to decide on who they can trust and who they can connect with?
So I think that it depends on what that online presence is, right? If a physician doesn't have any online presence, what normally is the first thing that comes up, right? It's something from a patient review site, right? Or Google reviews, right? And sometimes who are the patients who write these reviews? In general, there are people who are dissatisfied with the care. So if you don't control the narrative, the first thing that might come up would be multiple one-star patient reviews. And really that isn't the best thing. So I think that, creating that information, making sure what's online is accurate, right? Because a lot of times if a lot of these sites like Health Grades or these patient review sites, it's just simply inaccurate information, and that's not what patients want. And then once you have that narrative, then you could, create a little bit of content, build that online reputation about yourself. Having a LinkedIn profile, I think, is tremendously important, and having accurate information about where you trained and where you did your residency and internship, I think it's important. A lot of times patients choose me simply because of where I trained. They don't care about my podcast. They just want to make sure that I had the appropriate training, whether I'm board certified. This is all basic information that you take for granted online, but it's not always the case. It's not always accurate online. So just make sure that information that surrounds your name is accurate, because that's what patients look for when they Google you.
Yeah, no, I think that's sound advice. We like to say in our upcoming book that, you are who you say you are who your patients and your colleagues say you are, and you are what Google says you are. So I think it's very important to be able to control the narrative so that patients can truly understand from other patients, because I really believe that's a major influence as to how healthcare is being communicated right now. On Facebook, I went to see this doctor, he was great, it was this. And so word of mouth from patients that are then sharing it across social media can amplify that message for our patients as well. So again, so for the patients that are listening right now, what's the takeaway, for the patient? How are these stories that you're sharing and these other doctors are sharing and developing this online presence? What's the takeaway for them to feel more confident and informed and connected with their doctors on the healthcare stories that they're reading about or listening to?
So I think that I encourage patients to do research on their doctors online. It's important to build that relationship. Whatever they can do to build that relationship before they go in, I think it is important, because it can only strengthen that bond. In general, when it comes to researching information online, just be careful about who's giving that information. There is a lot of misinformation on AI and Google. So be careful about what they read, who's funding it, the organization and the agenda that they're affiliated with. I think that it's important for patients to be critical about everything that they read online, because I think increasingly that information is becoming less reliable. So the more that physicians are online and build that authentic presence, I think that the better it is for patients. And then again, if we can have that trusted relationship online with patients, it's going to only help them as they do more research online.
So the doctors should have a responsibility to be able to share their messaging, and then the patients should be doing their due diligence to really make sure that they can match up with the right doctor, and hopefully that communication really will be the path forward. So listen, Dr. Kevin Foth, thank you very much for joining us on the Smart Medicine Podcast. Your insights remind us that storytelling is super important for communication and connection. You've shown physicians everywhere how to use their voice to educate, to inspire, to lead. We're very grateful for your time today and the impact that you've had in helping to shape doctors' digital presence with purpose and authenticity. Thanks for being here, Kevin.
Thanks for having me on the show.
Kevin reminded us today that behind every click, every post, and every podcast episode lives an opportunity to deepen the physician-patient relationship. And I truly believe physicians still hold one of the most trusted voices in healthcare, if we choose to use it. That's why owning your online narrative matters, and why authenticity has become the real currency of modern medicine. A smarter digital presence isn't just about self-promotion, it's about connection. And to me, that's smart medicine. Thank you for listening. This is Dr. Scott Sigman. I'll catch you on the next episode.